Hello, this presentation will describe the Allied Health reporting process for residential aged care providers when submitting quarterly financial reports. Allied health services are an important component of residential aged care. As part of the services they provide to residents, providers of residential aged care are required to provide an allied health therapy program to all residents according to their assessed needs. In the QFR, allied health data is collected for three purposes. The collection and tracking of allied health data ensures that providers meet their responsibilities under the Aged Care Quality of Care principles. Secondly, to monitor and report on the delivery of allied health services to promote transparency. And thirdly, to inform costing studies, annual pricing, and policy development. The quarterly financial report contains allied health sections for care expenses and labour hours. Data is collected under the following categories: physiotherapist, occupational therapist, speech pathologist, podiatrist, dietetic care, other allied health assistance. For an expanded definition for other allied health professions, please refer to our website. For each aged care home, the QFR requires the total labour costs and labour worked hours to be reported against their relevant category. Please be aware of the applicable inclusions and exclusions to data reporting in the quarterly financial report. For allied health reporting, services delivered via telehealth are applicable and should be included in the QFR. Hours worked by agency or contracted staff should only be included where they are funded under the Australian National Aged Care Classification Model. This applies to all hours for government subsidised residential aged care residents, including those receiving residential respite. Privately funded allied health services funded by health funds and the Medicare benefit schedule should not be included in the QFR. Similarly, allied health services funded by the National Disability Insurance Scheme or by the Department of Veterans Affairs should not be included. Allied health services delivered to transition care or privately funded residents are also excluded from reporting. Speech pathologist data is collected in both the residential care expenditure and nutrition reports in the QFR, with the food and nutrition section containing only those hours and expenditure related to food, nutrition, and the dining experience. For speech pathology reporting, the residential care section of the QFR should include all care expenses and hours for a speech pathologist engaged by the provider. Hours and expenditure for speech pathology must only be reported for practicing speech pathologists that are certified by Speech Pathology Australia. The food and nutrition section of the QFR includes only care expenses and hours for speech pathologists related to food, nutrition, and the dining experience. This mainly covers but is not limited to chewing and swallowing therapy. To ensure that the allied health data can be measured and reported accurately, it is recommended that separate general ledger codes are set up and structured to capture expenses and hours for each allied health category. Relevant hours and expenditure can then be reported directly for each allied health category. For allied health reporting, please ensure that general ledger codes are set up to capture invoices according to their allied health category and that costs for each role are accompanied by the hours of care provided by allied health staff. For agency staff, please ensure that the specific services performed are clearly shown on tax invoices and that all hours are recorded from the invoice so that the cost in the tax invoice can be validated. To ensure they can be reported separately, invoices for allied health services should be split by category, each displaying the hours spent and relevant costs for each service. A structured chart of accounts as shown on the right can allow for the accurate collection of allied health data for reporting in the QFR. Each allied health category for both agency and employed staff should have their own account to ensure they can be reported separately. For staff employed by the facility, ensure that the care costs can be attributed accurately to a specific account. The payroll system should be configured to report the care hours for each allied health category. For agency services provided to the facility, it is recommended that the service provider be required to supply a breakdown of the services performed as shown in the table below. An accurate description of the services along with the relevant hours and costs for the services will allow this information to be reported in the QFR. Accruals are an important part of the QFR. To ensure that data reported in a quarter is an accurate representation of the services delivered, hours and expenditure should be recognised in the same period that labour services were delivered, rather than when invoices were paid. This ensures that the hours included in a quarter are matched with the costs associated with those hours, and vice versa. When reporting hours and expenditure for the QFR, please ensure the following. The hours and expenditure reported must relate to the current reporting quarter only. Invoices are to be allocated upon receipt to their relevant reporting quarter based on when services are delivered, rather than when they are paid. Hours and expenditure should be reported for services delivered between the first and last day of the reporting quarter, rather than pay cycles which may straddle the end of one quarter and the start of the next. Adjustments should be included where they relate to the current reporting quarter only, rather than to reconcile with prior quarters' reports. For further assistance, please contact the QFR and ACFR Help Desk at qfracfrhelp@health.gov.au. For technical assistance or other questions about direct care reporting, residential data quality checks, or completing the QFR, see the Help Desk reference guide.